The Association of Public and Environmental Health Officers proposed to embark on an industrial action on 5th April 2022 if their allowance demand is not implemented. The association demands its membership to be included in the new allowance package that the government approved for PhD holders and medical doctors serving the Ministry of Health. The Vice President of the association, Musanget, explains the various steps his association has taken before reaching such a conclusion.
In his first letter that was addressed to the Secretary General and the Head of Civil Service, dated 2nd March 2021, the association, in collaboration with the National Pharmacy Staff Association, highlighted their dissatisfaction regarding the bizarre decision sought for. 1. Immediately suspend or reverse the decision on the recent approval of allowances for few selected individuals, which is discriminatory and unfair to the hardworking directors, program managers, program officers, health facility staff, and frontliners. 2. Use the allowance proposed to initiate the appointment of health laborers, workmen, orderlies across the country as soon as possible. Some are volunteers for over 2 years without salary. 3. Initiate a review for allowance increment for all cadres in the Ministry of Health.
He adds that after several consultations, they wrote another letter to the Office of the Secretary General and Head of Civil Service dated 28 September 2021.
The association wrote another letter to the Office of the Secretary General and Head of Civil Servants, reference GAFO/SG/01/21 dated 28 September 2021 and copied relevant authorities. Nevertheless, on the 6th of October 2021, Amadou Dabo, Principal Secretary, Minister of Health, on behalf of the Permanent Secretary, PMO, wrote to the Vice President of the Association of Public and Environmental Officers of the Gambia. This letter said, the following reference, AD 260-418-01 Part 1 87, I quote, relating to the above captioned subject matter, and to further convey that the Ministry is seriously working on paying equal allowance to that cadre and calculations already done.
Musanget expresses their disappointment that no public health officer within the country is benefiting from the said allowance since the receipt of the above letter 5 months ago.
To our dismay, after 5 months since receipt of this letter, no public health officer within the country have started benefiting from the said allowance, even though a specific cadre started benefiting from a new allowance scheme since the month of September 2021. After those engagements, the mandate of the previous executive came to an end. The new executive was elected in January 2022 to continue running the affairs of public and environmental health officers in the country.
Mr. Ngate explains the efforts their new executive explore to accomplish the allowance advocacy started by their predecessor.
The new executive was elected in January 2022 to continue running the affairs of public and environmental health officers in the country. On the 8th of February 2022, the executive of APEC made their first protest call on the Director of Public Health Services and also discussed many issues affecting public health officers and the services they provide to the public. Among the many pressing issues tabled were the exclusion of the public health officers in the newly developed allowance scheme for the Ministry of Health staff, among others. In his response, the Director of Public Health Service said his office is working tirelessly with the various stakeholders, that is HR, Ministry of Health, Permanent Secretary, and the PMO, to resolve the problem so that PHOs can receive the allowance like other cadres that are currently benefiting. He further stated that subsequent meetings on the allowance issue is scheduled for 9th February 2022.
He narrates that after making follow-ups with the Director of Human Resources for Health, Director HR, Ministry of Health said the requested information was duly sent to PMO for onward review and action, but nothing is done.
The executive and the entire membership are concerned with the long silence of the PMO upon receipt of the requested information from the HR Ministry of Health. While we provide the same service to the population, we might seem to have been seen differently and treated different than our sister cadres, which the general orders and the civil service codes of conduct does not support. The general membership of the Association of Public and Environmental Officers have agreed that as an association with mass represented in the Ministry of Health, we strongly condemn that the allowance issue be resolved before the 5th of April 2022, contrary to the meeting the demands by the aforementioned day. Public health officers across the country within the Ministry of Health will lay down their rules.
The Association of Public and Environmental Health Officers is a registered non-profitable association in existence since 1971, serving the health professionals specifically and communities in general, with its membership serving in both private and government health institutions across the country. Among others, they are responsible for surveillance and disease control, including contact tracing, especially during the peak period of COVID-19. Reporting for Kerr, Fatou, I am Buba Gajigo.